intramuscular injections.
So for intramuscular injections, we're going to go ahead and start with the Toradol injection. So this is also known as Ketorolac. So when you are getting medications ready, you're going to be in the med room. So imagine that I'm in the med room right now. First thing I want to do is pull up my order. So I want to verify my order. And I see that it says Toradol, 30 milligrams per ml is what the pharmacy gave me. And my order is 15 milligrams IM every 6 hours, PRN, pain. So there's a couple things I just want to point out about this. My dose is going to be 15 milligrams. So that means I'm going to pull up half an ml. The half an ml is my volume, but my 15 milligrams is the dose that I'm documenting. And then the PRN for pain means I need to make sure that this is okay for the patient to have this at this time, that it's been at least 6 hours. So I have confirmed that the patient is okay to have it, so I'm going to gather my supplies. The supplies that I need are some gloves, and then I need a 3 ml syringe with a 1.5 gauge needle for the injection. And then I of course need my drug, my Toradol, and I need a filter straw. And I'm going to go ahead and need a medication label, and then I'm going to need an ampule breaker, and I'll show you how that works in a second. So I'm going to go ahead and put my gloves on, and I'm going to confirm my medication that I pulled out from the Omnicell or wherever you're getting your medications. I'm going to confirm this, I'm going to verify this with the order. Yes, this is indeed Toradol, 30 milligrams per ml is what I have, and I'm going to give 15 milligrams IM, so I'm going to go ahead and draw up half an ml. And I'm going to, of course, check the expiration date on this vial. Because this is a glass vial, we need to use a filter straw to prevent any glass shards from being drawn up into the syringe. So the first thing I'm going to do is just go ahead and prep the injection. So I'm going to open my needle. I'm just going to open it like that. And then I'm going to look at my ampule. I'm going to go ahead and sometimes there's liquid that gets caught up in the head of this. So if that happens, you can just hold it firmly and swirl it counterclockwise, and then that's going to take all the liquid down back into the vial so it's not up here. So you're going to take your ampule breaker, and there's little claws on the bottom of it, and the claws go on the bottom. So you're going to put the ampule breaker over the top of the vial, push down all the way till you hear a little click, and then you're going to go ahead and break it. So you're going to put your thumbs together, and you're going to hold it away from you, and you're going to break it away. So you're just going to snap it. And then this is sharp, so it goes in the sharps container. So now I'm going to go ahead and withdraw the fluid out of the vial. So I'm going to take off my needle, and I'm going to open my filter straw. The best way to open this filter straw is at the end where you're going to connect it. And when you are looking at these, this will make sense to you, because I don't want to touch this end here. I want this end that's going to pull the fluid up to be sterile. So I'm going to open it at this end. I'm just going to peel it back, and I'm going to attach it like this and twist it on nice and tight. Then I'm going to break the seal, and because this is an open air vial, I don't need to inject any air into this because it's not a closed system. This is an open air. So I'm just going to, at eye level, do your best to pull up the fluid without knocking the filter straw against the glass vial, hitting it on the bottom. Just do your best as to prevent that. It's a little bit impossible, but if you have a steady hand, you might be able to do it. So you're just pushing this in, and then you're gonna just pull up. What we need is half an ml, so I'm gonna pull up just a little more than half an ml, just so I can see what I have here. And you'll see that I have lots of air in my syringe, and air is bad because we don't want to inject air into our patient, but we also don't want any air in it because that changes our volume level. So I'm going to go ahead and get the air out. So I'm going to hold my syringe like this, and I'm gonna tap it. That chases all the air to the top. And now I can go ahead and dose it. So let's pretend that I'm over a sink now. So I'm holding the syringe straight up. I don't want to try to get the air out like this because air rises, and if I do it like this, the air is just going to come back into the bottom of the syringe. So I want to hold it straight up, and I want to dose it till it's 1/2 ml. And then I'm going to connect this back together here with this filter straw wrapper, and I'm going to disconnect it, and then I'm going to connect it back on my needle. And I'm going to twist that on nice and tight. Once again, I have 1/2 ml, which is my 15 milligram dose of Toradol. So I'm going to get rid of my sharps containers here. And now I am ready to take this down to the patient's room. But before I can leave the med room with this unmarked label of this unmarked syringe, I need to add a label to it. So I'm going to take my pen and I'm going to write the date and my initials and that it's Toradol for this patient. So you're going to write the information on there, and then you're going to go ahead and place it on the syringe. Okay, so that is my Toradol. Now, my patient also needs Rocephin. So I have gathered my Rocephin supplies. So Rocephin is an antibiotic, and I'm looking at the order, and I see that it says Rocephin 500 milligrams per ml, IM every 12 hours, and this patient receives this 8 a.m. and 8 p.m. So I'm going to pull my medications out of the Omnicell, and I'm going to look at them. I'm going to look at the expiration date. I am going to look at my Rocephin, which comes in a powder form. This is the one where we have to dilute it. So I'm looking at my Rocephin. Yep, I see that the expiration date is good. And then I also am going to pull out my dilutant, and I'm going to also check the expiration on that. So the supplies you need for this are your powder and your dilutant, of course another label. You're going to need a filter needle this time, and then you're going to need a 10 ml syringe and a 3 ml needle with a 1.5 gauge for the injection. So just because these have lids on them, you still need to clean the vial, because we just call these dust covers. So you're going to pop the cover off of them each, so pop it off. And then you're going to take your alcohol swab and you're going to clean it for 15 seconds. Get another alcohol swab, clean this one for 15 seconds. So while that is drying, I'm going to get my syringe out. So one thing that I need to know is, how am I going to dilute this? What's my dose again? So on the back of this vial, I can see that it says the strength that I need is 500 milligrams per ml. In order to get that strength, I need to dilute this with 5.6 mLs of diluent. So I need to pull up 5.6 mLs of this diluent. That's going to give me a total of 6 mLs in this vial. All right, so how do I pull up 5.6 mLs of diluent? Can I use this 3 ml syringe? No, because that's not enough. I need a big 10 ml syringe to pull up that amount. So I'm going to open my 10 ml syringe. Maybe. Sometimes they come with a little cap on it. You can twist that off, throw that away, break the seal. And now is when you would apply this filter needle, because once again we're injecting a drug that we've reconstituted into the patient. So when we're pulling this medication up, we just want to use a filter needle just so we don't pull up any particles of the powder with it. So this twists off, and you throw that away, and then you just attach that via lure lock. All right. So I've cleaned everything. So what I need to do is Take this off, and I'm going to put this gently in this nice little container here so that when I go to re-scoop, I don't have to chase it across the table. It's just already contained in this package that I have. So if you remember, I said that we needed 5.6 mLs of diluent to be added to the powder. So I'm going to go ahead and pull up 5.6 of air. So what I'm going to do is inject air into the diluent, push down. You'll meet this with a lot of resistance, but keep your thumb down. And then you're going to pick it up while your thumb is still depressed. You're still keeping resistance. And when you flip it over, make sure that the needle is in the water. And then when you flip it over, it should fill on its own for the most part. So you just let it fill on its own. And then you also, at some point, it will slow down, and then you have to help it along. Making sure not to touch this part of the plunger because that's the sterile part of the plunger, and we don't want to touch the needle part either. So the best way to do this is you're just going to have to practice so that you handle the equipment so that you're comfortable with it. So what I'm doing now is I'm working here. I have almost 5 mLs. So I'm just pulling this back a little bit. So what do we have here? Okay, looks like I have 6, but I have lots of air bubbles in there. So I'm going to push the needle back into this vial, and I need to get these air bubbles out. So I'm going to secure the needle and the syringe, and I'm going to chase those bubbles up to the top. So there's no bubbles at the bottom. There's a little one there at the top, but I'm going to chase it right out. So now that I have the air out, now I can dose to my 5.6. Okay, so now I've dosed it to my 5.6. I'm going to take this out. Now I'm going to put this 5.6 mLs of diluent into my powder, and I've already cleaned this off. So I'm going to inject this here. And again, you're going to meet this with a little resistance because it's an airtight container. So when you push this in, now I have my fluid in the vial. If I let go of my thumb now, the air will retract back into the syringe and it won't make such a psh sound when you remove the needle from the vial. So just let the air come back through to the syringe. Okay. I'm not done with this filter needle yet though. So remember, I was going to scoop it up. Okay, so I scooped it up. I'm just going to set this down for a second. Now I'm going to pick my powder up, and I'm just going to roll it gently in my hand. I'm not going to shake it because that could produce more air bubbles, which I don't want. So I'm just going to roll it until the powder is all mixed up. And we're going to say it's all mixed up now. So again, checking my order again, if I forgot, if I want to make sure, I'm drawing up 500 milligrams. So that means I'm drawing up 1 ml. So my dose that I'm giving is 500 milligrams. The volume that I'm giving is 1 ml. So when you document, you always document that you're giving 500 milligrams. You don't document that you gave 1 milliliter because no one knows what that means without knowing the concentration. So always make sure that you're documenting the milligrams or the units. So I'm going to open my 3 ml syringe, and I have another alcohol swab. So what I'm going to do is disconnect my filter needle from my 10 ml syringe, and I'm going to attach it to my 3 ml syringe. And I'm just going to put this injection needle just right down in the package again so it's nice and safe. I'm going to get an alcohol swab, and I'm just going to clean this because I have held it in my hand, and I just want to make sure that I'm keeping everything clean. So because I'm drawing up 1 ml, I'm going to get 1 ml of air. Take the cap off. And I'm going to inject my air. Flip it. Make sure my needle's in the water. Otherwise, if you don't, you're just going to get more air. And then you're just going to gently, steadily pull back. Right now I have just a little over 1 and I have some air in here. So let me see if we can get this air out. pushing it back up into the vial, secure it, chase the air up. That was a lot of air. So it went up, I'm chasing it out, so there's no air, no bubbles in the syringe. And then I dose it to 1 ml. So now that I'm done with that, I'm gonna go ahead and scoop my cap back onto my filter needle, twist it off, and I'm gonna pick up my actual needle and attach it. So make sure that when you attach your actual needle that you twist it on tight, because nobody wants to give an injection and have the needle be loose and it falls off. So now that I've done this, before I can leave this room, I need to label this, because as you remember, I'm taking 2 different medications to my patient, his pain medication and his antibiotic. So I'm going to label the medication type, the patient's name, my initials, the time, all of that. So I'm taking this down to my patient's room. Okay, so I'm going to get rid of my supplies here.